Hi everyone, welcome back. My name is Brandyn Dunn. I'm a facial plastic surgeon here at Coastline Plastic Surgery in beautiful Newport Beach, California. Today we're going to be talking about the ins and the outs of chin liposuction. Let's go. Liposuction of the neck, chin liposuction, neck liposuction, jawline contouring and liposuction, all can be kind of used as the same verbiage for ultimately the same treatment. So this is a procedure where I use a liposuction cannula to remove the majority of the fatty tissue that lies just underneath the skin, underneath your chin, and along your jawline. This gives you a nice smooth contour and a well-defined neck and jawline. So let's jump into the details. I see you for a consultation. I evaluate your skin quality. I want to make sure that your hyoid or your voice box is in a good position. It's really important to kind of understand the positioning of the deeper structures of the neck to make sure that you can understand what sort of an outcome you can expect afterwards. So if you have good skin quality and the voice box and the jawline and the deeper structures of the neck are in optimal positions, then you're a good candidate. Liposuction can be performed in the office or it can be performed in the operating room. I would say it's more common for most of my patients to have it performed in the office. It's really well tolerated, it doesn't take a long time, and most people actually kind of bounce back to most of their normal activities pretty quickly. But if you're bothered by needles or you don't want to kind of be awake and you want to be asleep for this whole thing, we have a full Rolls-Royce experience with you going to sleep under anesthesia, and you can have your nice new neck and jawline. So when you come in for your procedure on the day of the procedure, if we do it in the office, which like I said is the most common, it typically is about an hour to an hour and a half of your time. You'll get in here, I'll give you some medication to take before to kind of relax you a little bit, make sure that you're nice and comfortable, give you an antibiotic to take before to make sure that we minimize the chance of infection. Once we see you here, I'll make sure that you're feeling good. I'll draw everything out to make sure that we're kind of in an agreement so you can understand where I'm going to be working and where the majority of the fatty tissue that I will be removing. After I've done that, then I begin the numbing process. The numbing process is probably the part of the process that can feel a little bit odd, but it's generally still very, very well tolerated. I do small 3 pinpoint incisions about the size of my pinky. They're one behind the ear, the other behind the ear, and then one underneath the chin. That allows me to get access to that fatty tissue underneath. When I do that, in preparation for those incisions, I inject a little bit of numbing medicine into there. So when I inject that numbing medicine, it can burn a little bit, but it's generally just kind of like a little bit of a pinpoint. The next thing that I'll do is I'll inject tumescence. Tumescence is fluid that helps to minimize bleeding, make sure that you're still numb for the procedure, and help to mobilize the fatty tissue so that it can come out very easily. Most patients describe this as feeling full, a little bit tight, a little bit swollen, a little bit of pressure in your neck, and I'd say it's a little bit funky, but most people do fine, especially if you expect it and anticipate that. One of the components of that tumescence is something called epinephrine. Epinephrine is a drug also known as adrenaline. It tightens the blood vessels and it minimizes bleeding and bruising after the procedure. That can sometimes increase your heart rate, make you feel like you're going for a 6-mile run, but just lying there in the chair. After I've numbed up the entire area, the next part that I do is I start to begin the procedure. In the beginning, you feel a little bit of tugging and pressure. I've had some patients describe this as a deep tissue massage, which I'm not sure that everyone is in agreement with that, but some individuals describe it as that. Others feel a little bit of tugging and pressure, but you shouldn't feel any pain or discomfort. The liposuction portion of the procedure is generally about a half an hour to 45 minutes, depending on how much sculpting, manipulation, and kind of manual removal of the fatty tissue I need to do. I spend a lot of time trying to make sure that the skin is very evenly distributed in the amount of thickness and making sure that I maintain a nice little layer of fatty tissue just underneath the skin to prevent any sort of unwanted complications. After that, I put a couple small little stitches in those incisions behind the ear and underneath the chin. And then I wrap you up, make sure that you're all nice and supported and snug and there's pressure. I keep that pressure dressing on for the first 24 hours. I see you back in the office for the next day. Take off that wrap, make sure that you're healing well, make sure that there's nothing concerning at all. Very uncommon, but just make sure that everything is doing all right. And then we switch that to another wrap. So once I switch you to the other wrap, that you're gonna be wearing 24/7 for 7 days a week, making sure that your neck is nice and supported and that the skin tucks down the way that we want it. So the only time that you're gonna be taking that wrap off is when you're showering or when you're cleaning the incisions. And I'll go into the details about how to take care of your incisions and how to make sure that you kind of optimize your result. From that point forward, most of the time at around the 1 week mark, most of my patients are kind of back to all of their normal activities. So about 5 to 7 days, you're back to all of your activities. Throughout that first week, after the first night, most people have minimal to no pain. So it's generally a pretty well tolerated procedure with minimal pain medication needed. Your final results are typically around 3 to 6 months. It takes a little while for all of the scar tissue to break down, all of that collagen to reform, and all of your skin to kind of tighten up. But once you get to that 3 to 6 month mark, you're healed up, you're looking great, and you and I are both super happy. So as I was saying, it's not a procedure for everyone, and I think it's really important to be evaluated by a professional to make sure that you are a good candidate. One of the biggest qualities that is important to make sure that you're a good candidate for liposuction is skin quality. And I will tell you that while age is just a number, skin quality does correlate very closely with your age. And so the majority of my patients are in their younger years. They're typically in their 20s and early 30s, and those are the individuals that tend to have the best result. I have definitely performed liposuction in individuals that are older than that, but you got to be a little bit more cautious. So if you're thinking about this procedure, you've seen really nice results, and you think you may be a good candidate, it's really important to be evaluated to make sure that you actually are a good candidate, that it's not going to create more problems. So I know that's a lot of information. If you have any other questions, leave them in the comments. I'd love to see you guys in my office for a consultation. If you think you're a good candidate, come in, I'll evaluate you, make sure that you're a good candidate. And if you're not, I've got other options. I got other tricks up my sleeve. So I'll see you guys soon.